Good evening and welcome to VI Voices. I'm Emile Henderson III, along with Clint, Ferris, and Yoki, Hanley. We're taking in this episode a quick break from our analysis that we've been doing with the election show to bring you what we think is a very important topic here in the Virgin Islands and abroad, actually, and it's mental health and mental illness. As you know, May is Mental Health Awareness Month, and we have with us Dr. Dara Hamilton, who is with the Association of Virgin Islands Psychologists. She's the actual president of that association, and she's here tonight to talk with us about mental health issues. And we're hoping that will be a show tonight's show will be a show that you can definitely learn from, and that we can remove the stigma of mental health, not only here in the Virgin Islands, but within the Black community abroad. But before we begin with that, we will start our show as we start with every show, our hot topics. And we begin with, over the weekend, Sunday evening, we had an inmate from the Golden Grove Correctional Facility, adult correctional facility, escape. But not only did he escape and actually raped someone. And it took quite a while for the community to be notified that he had escaped. In addition to that, it took a while for the prison to even know that he had, in fact, escaped from prison.
He didn't. The prison knew he escaped once the woman reported the crime. So basically, he walked out to the place, say, I'm going to check on you later, and he went to go do his business. So if, he was able to control his urges, you understand? God only knows where he would be now.
And based on the account, the rape was reported about 3-something in the morning, and the police department actually called over to the prison to go check and see if he was there. And the prison, of course, from what I understand, the last count that they would have seen him would have been somewhere about 5:30 in the afternoon before he escaped.
What I heard, it was actually 9 o'clock was the last head count. 9 p.m. was the last head count.
But they couldn't confirm him.
But even so, the next scheduled head count was supposed to be, I think it said 2:30.
Right.
So, if they did a head count at 2:30, how come they still didn't recognize he was missing or notice he was missing at that point? Because it was reported, or they found out. Right. They found out after that.
Right.
So, Boyd, what you're basically saying, let's go back to what the good judge said, is that at 5 o'clock was the last time that they confirmed that he was there.
Right.
So somewhere in between, let's say that there was some misinformation given by the Department of Correction.
Right.
So somewhere from 5 to 3 o'clock in the morning, 10 hours, no one could account for this particular prisoner. And you see, and that's where we have a problem with the Virgin Islands Department of Correction, the Bureau of Corrections. And that's the challenge. How many, for the last 2 years or last 18 months, how many people have escaped it from Golden Grove?
At least one.
At least one plus this one. At least one.
I think it's been like in the last 5 years or so. Yeah.
No, but there have been more incidents of escaped prisoners throughout the system. About 10. And even in St. John, they had a woman walked away from. Am I correct? There was an incident earlier late in the year in St. Thomas, and there was a lady.
At their center,
But what makes it so egregious is the fact that they didn't know until he actually committed a crime outside. With the others, they knew, they were able to alert to say, hey, be on the lookout for whatever. What this shows is gross negligence, gross misconduct, and all of this is terminable offenses. Right? To be fired from the head straight down, because even the same officer who was supposed to actually go and physically do the check should be let go, because that's saying that they're standing up from wherever. Are you there?
But in defense of, if you can, of the corrections officers, they are severely overworked over there, and the manpower and are completely understaffed.
Right.
And I think it's a danger to them because there's a certain ratio of prisoners to corrections officers, and I think in the Virgin Islands it's triple.
But and so that you got to take into consideration downtime as well, time to rest.
No, but hold on. I do understand that, but they get paid overtime.
Exactly.
They get paid overtime.
Actually, no. In theory, they do.
In theory,
they do.
But
no one should be working 24 hours straight.
Okay, I understand.
No one should be working 16 hours straight.
Against the law.
And that's what it is against the law.
But let's not. It's against the law. But let's not minimize it.
I don't think he's minimizing it.
But I think what's egregious isn't just the fact that the person had escaped. It's the fact that this criminal escaped the detention, Golden Grove. That to me is egregious. That the people trust was tested, and it continues to be tested when the correctional facility isn't doing what it should be doing, whether it's keeping them in and or rehabilitating them in the process. So it's a big problem.
The thing is how he got out, how he could pass two secured areas because
So-
he got out the building and then he get past
He
the first
opened the door,
line.
walk out.
So you're telling me that? So I still go back to say the officers weren't doing the job, and all in all,
Because the officers
doing
are tired and sleeping. That's the point.
But even so, it
the
still
warden,
goes up to the top, you
the
know.
warden and the director of the facility are to blame as well.
They need to be
Of course, I
fired.
think they should be
need
the
to be
main
fired.
blame.
Yes, they-
Because I think that it's easy for us to blame the corrections officers. It's easy for us to say that. Well, you should have been watching them. But when you look at what they have to do over there, now I'm not saying all the corrections officers are great, and that's what I'm saying. But when you have one correctional officer who nationally they say a corrections officer should not be having to watch over more than 5 inmates, if that much.
Correct.
But they're having to per officer,
correction.
right? But they have to look at 16 or 7, one alone.
Correct.
Or you have some of them who are in a dorm area where it's just them.
Yeah, right.
And nobody else to support them.
And then it's
just them.
overcrowded.
And then you have people, he's working there, you're supposed to relieve him, you don't show up because you decided to do whatever, you don't show up. He can't leave. He's already been there 16 hours. He now has to stay your 8. He can't leave. Okay?
Lot of
So he's been
different
24
factors.
hours.
Right.
So that's why the federal report that came out, that hearing was so important because they said it to us. They said you have unsafe things going on at Golden Grove. You are overworking your corrections officers. Their safety is in jeopardy, as the safety of other inmates are in jeopardy. There are no real protections on the perimeter of Golden Grove. They said that. They had the hearing last week. And look what happens now on Sunday.
Correct, but you see, and I'm not dismissing the fact, the state of conditions at Golden Grove, but I still say the officers have a part to play. Everybody have a part.
I agree.
You know
but
who
I
has
was,
the biggest
but I
part
was
to
going
play?
to fire the director
No, I was
of the
starting-
Board of Corrections.
I was starting with
because
the head,
he
and then
sat
I
in the
started-
legislature
The
and told them
directors, but
everything is going well.
his argument gonna be that lack of funding. In fact, he don't say
No,
lack
he's-
of funding. That's
No,
gonna
he
be his
didn't say that.
argument.
He
Yeah, he
said
did.
everything
He did
was
say
going
that.
well.
But he
No.
didn't say that.
He
didn't
didn't.
No, he said-
did say everything was peachy
No,
keen.
today
That's what he
news,
said.
today the news he said lack of
Funding.
funds,
That's what he said
lack of
today.
lack of resources,
That's what he said today.
and within 20 days the
But that's
cameras
not
are going
what
to
he
be
said
up.
before.
All of that. To me, I'm tired of this. I'm tired of this nonsense.
We're reactive.
Yes, send him home.
But you know what's even more egregious with all of this is that our government come out and say or do anything.
But
But what he say, he's the one that defended him when the senator tried to
This
get
is
rid of him.
not only is it on the one who runs the Bureau of Corrections, it falls square on the
Hey.
governor's feet.
Again, I
Yeah,
Because
well,
say,
you
he
see what-
nominated him,
and that's
right?
what I'm saying. He is not coming out. So what he's basically
Well, he didn't leave
saying-
Doc Sessions.
Yeah,
he really
he-
felt
thank you,
something
thank
happened.
thank you.
Yeah,
And
yes.
another funniest thing about it is, again, our legislature, they're also complicit because they voted didn't they approve this the nomination?
Well, not this one. Not the
Julie-
30th.
not-
He was approved before.
okay.
Yeah, not the
Tell me-
legislature.
no, let me say,
Yeah.
So somebody approved them. There's nobody that we haven't. This administration. There's not a nominee that has come from this administration, whether qualified or unqualified, that they have sent them, with the exception of one person. And we keep recycling people that should not be in leadership in government.
But there's a government, it's the administration itself, because again, apparently the legislature can't do nothing about
No.
it, because it's against the law for them to he was already nominated, he's already confirmed.
There's nothing they can do.
So there's nothing-
Isn't the Senate the one to write the law?
Yeah, they
Yeah,
can't.
but that is separation of powers.
That's right.
And so that's a
But you see,
constitutional
the
issue.
thing about it is, they are body because if you really want to put a squeeze on this governor and this administration, when you want something, you say either you send Julius home or you don't get it passed. But they have not, and they have not been doing that. Everything that this governor has wanted has been signed off on.
But possibly, okay, this is a quick, good segue. Possibly a new resident would be at Golden Grove, and that might be Laura Willis, who has been charged with tax evasion and indicted now recently, last week on Friday, indicted for bribery charges in federal court. This is the second charge. I presume that what's going to happen, they might merge those charges together and just do one thing in district court, or let one go and move with the other. But that's a story that we're going to be following as we go along, because it's very important to see what's happening. I'm not sure that to me, it is what it is. I don't feel sorry for people who engage in public corruption, but he's low-hanging fruit on the scale of people who are publicly corrupt.
Correct, because I find it strange. He was the executive director of the legislature and the president at the time was Hill.
Right.
And if you know the creatures who were in leadership at the legislature at that time, and you're telling
Somebody
me they were
outside, not
I mean, Lolo Willis is out there by himself, and I don't think he was out there by himself.
Well,
doing these
we're
things.
going to see
Yeah,
how
it
great
appears
a
that he
tenor he is, you
Well-
know, if he could reach that high C note.
Well, we'll see. And, you know,
He-
as you know, well, anyway.
Yeah, leave it about
When we get back, we will have Dr. Hamilton with us. We'll be talking about some mental health issues. And as we know, at the jail, there's a myriad of issues with mental health. That one of the things that are within the consent decree is the lack of proper facilities for the mentally ill who are charged with crimes and convicted as a result, or found guilty as a result of being insane.
But Emile, if we don't
And
have
so-
none outside, how do you expect
Well,
to
we'll talk about it when we have
Inside.
Dr. Hamilton. So we'll be back in a moment with Dr. Hamilton. Back in a moment. Good evening and welcome back to VI Voices. We are here with Dr. Dara Hamilton, who's the president of the Association of Virginal Psychologists. And May is Mental Health Awareness Month, and we are doing a special show tonight on the issues regarding mental health awareness. And I want to thank you. This is your first time with VI Voices.
Yes.
And so I welcome you to the VI Voices set. I'm not sure if you know the other co-hosts, Clint, Ferris, McFarlane, Yoki, Hanley, and you know, they are all mentally ill. I'm the only one who
You need to really
is not.
behave. Oh my God.
So I'm glad that we have you.
Let's get a definition of man.
I know, right? And so I'm glad you're on the show. But we want to talk about, to get our audience to understand a lot of what the issues are with mental health or mental illness, and the fact that we have so many in our community and within our race, the black community, that has a stigma about mental illness or mental health. So, like you said, that was a good question. Let's talk about what mental health is, what mental illness is, so that we can start that as a
There's
premise.
a difference, first of all.
Right.
There is a difference between. I'm sorry.
Okay, well, let me start by saying you're absolutely correct. 1 in 4 to 1 in 5 adults actually has a diagnosable mental illness. So that may mean that someone actually around this table is suffering from something that we may not know of. And that's okay, because to some degree it's a little bit normalized at that point. At some degree it just lets us know that this is much more prevalent than maybe most people think. We tend to kind of hide it and shun it away. There are several ways to look at mental illness. We can look at it as doing things that are aberrant or outside of what is culturally acceptable. We can look at it as the condition where you are experiencing symptoms that are leading to your functioning, impairing your functioning or impairing you in terms of being able to feel good and have a good quality of life. So there are a few ways we can define mental illness. Of course, mental illness is diagnosed by the Diagnostic and Statistical Manual. So within that broad framework I've given you, there are very specific symptoms that allow for the diagnosis of specific mental illnesses.
And what are we doing here, at least on a peripheral factor? What are we doing for mental health? Because you said something just a while ago that you believe there's a difference between mental health and mental illness. Is there a difference?
It's two different words. That's how come I said, I know there's illness and then there's health. So I think, I'm only thinking, we got a doctor here who should explain the difference.
I feel like you have another hair that you want to slip there, and I'm going to jump in and see whether I'm identifying that correctly. I think that you're going from the absence of mental illness does not necessarily mean mental health.
Right.
Is that what you're saying?
Exactly. That's exactly what I'm saying.
Okay, so you're saying in the absence of mental illness, people may not necessarily feel good about their life, be on a path toward like self-actualization, self-determination, and be productive or happy in the way that they could possibly be.
Right.
I think that goes back to more of a philosophical issue as opposed to a medical diagnostic issue, but I do feel like they are along the same lines.
Philosophical. When you say philosophical, you're talking. Well, I've read situations where it goes back as far as Darwin and Freud and the differences between philosophies. Nature versus nurture. You understand? Because in the black community, we're talking about the black community. So the black community has issues because of said there are things that were proven that in the genes of your grandmother, you could find situations that took place from your grandmother. And the genes are actually passed, and those bad genes are actually passed on to the child, and they pass on for generations. So I think that's something we could look at in terms of that, in terms of the differences.
In terms of the philosophy, I was referring more to the fact that there are specific symptoms that allow for a diagnosis of mental illness. And let's say we're not having those specific symptoms, so we can't fall under any diagnostic category, but we're not maximizing our potential or maximizing ourselves in more of a spiritual fashion, which may lead to greater mental health, as you may be defining it. So in that way, the absence of mental illness does not necessarily mean...
How does spirituality plays a role in it?
And that's where the philosophy comes into play.
So spirituality is a philosophy?
Yes.
It is?
Yes, I would say so. I think it's rooted in philosophy, in your outlook on life, how you understand life, how you attribute meaning to life. I think so. And I think that there's a lot of overlap when you get into therapy. There's a lot of overlap between developing spiritually and having mental health. Spiritually outside of religiosity, of course.
Dr. Hamilton, let's discuss what's taking place in our community. We have heard the stories of people that are mentally ill and not having the right facilities, nor the right amount of support services to cater towards their needs. From your position as president of the association, what should be done? And do you guys have a strategic plan to help guide the Virgin Islands and making sure that these things are going to be put in place?
Those are very good questions. Of course, I have to start with resources. I think that more resources need to be put in place. We know that there was a consent decree, June 2009, that was put forth regarding the lack of services or the need for improved services in the Virgin Islands. And so we know that currently the behavioral health unit at the hospital is not functioning at our hospital. And so patients who have to be routed to the hospital have to go off island for treatment, which is not necessarily in their best interest. Typically, the clinics and so forth are understaffed, and there really isn't that outreach into the community to get people in for services. And so I think that the issues facing us regarding mental health are similar to health itself, to the broader spectrum of health, but then the other socially based programs in the community. So I think that resources, man resources, are definitely necessary. In terms of the Association of Virgin Islands Psychologists, that's something that we're kind of working toward, being more instrumental in developing some of the policies and the procedures and assisting with that. That's something we're working toward. I can't say that currently we have a plan. We do have a government relations committee, and they're tasked with following up on those types of issues, identifying our position on mental health and on the needs of the community, and working with that. I was invited to attend a discussion group in Puerto Rico in June to discuss some of these issues with respect to trauma and young children and developing an integrated system of care. And so that's one way we can contribute as an association, and hopefully we'll be able to.
But you just said something that I thought was very important, because what are we doing? I mean, we used to call the third floor at the hospital the place, the psych ward, the place where people would go. We don't have that anymore. No. What are we doing with the people in our community who have exhibited mental illness? What do we know for a fact that they have mental illness, but we have no way to really treat them?
Right.
What do we do?
And that's problematic, and we don't like to see them on the streets necessarily, but we also know that we can't hold people without their consent. If they are not posing an imminent danger to themselves or someone else that you can identify.
But where would they go, though?
Go out.
I mean, because before you can file, what is called a 722 or 723 on someone. Right. A family member can do that. Right. And the hospital will be required to hold them for 3 days.
Right.
And what would happen is that they'll give them medication, they'll do all okay, and then they have to let them go.
Exactly.
And then they leave, and then they don't take their medication. Right. And it's a continual revolving door of them coming back and coming back. But that's not working, though.
No.
So there has to be something is there something that we can do as a community to stop that, where all we're doing is keeping you okay for 3 days.
Right, exactly.
For you to leave and then come right back again.
And that was part of the part of the consent decree was to identify services for people who are being discharged. So if you're being discharged from a facility, what outpatient care do you need in order to keep you a little bit more stable? We recognize that not everybody is going to rebound in the same way, and some people are going to continue to have symptoms that don't necessarily allow them to participate in society the same way you and I may. And so, there's going to be some of that, but in having the services and the resources there is definitely the first step, instead of doing the 3-day and then you go out, the 3-day and then you go out, because that's not helping.
You mentioned something earlier before about children. First of all, how do you see this administration as really dealing with the mental health issue? Not only from an adult standpoint, but overall, including the children. And then in terms of, again, going back to the children, because I know that there's difficulties, especially for parents, for those that do recognize that there may be some issue with their child, to try and actually find someone who actually deals with children, rather than having to go to an adult psychiatrist or psychologist and have them now, try to tailor or, fit something that would be for an adult for a child.
Okay, so in terms of that, you're absolutely correct. For the first question there regarding the administration, I know that this has been something that particularly Mrs. DeYoung has touted as being something that's dear to her heart, and has taken some steps in the past years to promote mental health, reduction of stigma, or education. In fact, we've collaborated with her on doing a series of outreach to the community during this mental health month, and so we've been able to collaborate with them, and that's been a good experience, and I see that as growing in power next year when we come around to the same time, because it's been such a collaborative effort. I think it is a process, and we do have a need for more services, and that goes even to children, and especially to children. The same lack of services that we have for adults, we have the lack of services for children. We have a child psychiatrist who comes down, I think he comes once a month, and is coming from the States, and so having a child psychiatrist here who's our own to see children as needed would be would be something that would.
We don't have one.
We have one who comes down. He comes and
he's not here. He's not here and from here and lives here. No, the culture. No.
I don't think there's been one here for a while.
So-
For a long time.
So basically, Dr. Hamilton, not to put words in your mouth, but what I'm understanding is that the administration isn't doing nothing, because they're outreaching and they're bringing in awareness. And that's all we do in our community. Outreach, bring awareness. When do we really start to do the hard-hitting stuff? Because you're talking about not having a child psychologist, psychiatrist, psychologist, but we don't have a child psychiatrist on island.
Right.
When do we start to put those things in place? When we don't just talk about we have one, but we have two on island, or four within the territory to serve our population. Now, when do we track incidences and crimes of mental illness? And do we then keep a log to understand what's taking place in our community? Because by tracking things, we know we can then start to plot and theorize what's going on.
I don't know that we particularly track crimes committed by people who are diagnosed with mental illness. And I think part of that is many people don't go in for treatment, and so it's very hard to identify. Like we said, about 1 in 4, 1 in 5 adults have a diagnosable mental illness, but 1 in 4 and 1 in 5 are not going in for treatment. So it's hard to say people who are committing crimes have either this history or they have a diagnosable mental illness. That's not something that typically comes up. So that's pretty hard to do. Retrospectively, you see certain issues such as people who have committed crimes have a history of some type of abuse, or who have a history of school failure, who have a history of that type of deal. But in terms of tracking it with the numbers of people who are committing crimes who have diagnosable mental illnesses, that people don't typically go there. And I think that because the crime is the issue more so than the underlying, when we know the underlying is contributing.
Once they get into the prison system, we just spoke about all the other prison system not having the proper mental health facilities, facilities for them. So isn't it, I'm not sure how it's done, but what I'm asking is whether or not at that level, once they enter into the prison, aren't they supposed to be tracked there, or have people in place who can actually document that kind of stuff?
Yes, I think that I know I worked for a period of time in the correctional facility in Washington, D.C., and that was something that we did. We walked on general population blocks to see if anyone needed any help, that type of deal. And then they did have mental health facilities or blocks that were specifically for inmates who had diagnosed mental disorders. And so I would hope that they're trying to identify people who are in need of assistance as well, and that type of help, and then documenting it.
Why would we have to wait till when they commit a crime? Why aren't they being tracked from before? You know, and I heard you mention with outreach. One thing that I know that's very prevalent within our community is the fact that we have a lot of people that want to pray away the mental illness, you know, or completely send man, you know, Uncle Tommy special. He always been like that. You understand? That's too big a word. That's crazy. You understand? He's special. He's nice. You know, when the moon come, he acted for me and all this and that. You understand?
Cousin
And
Clint.
I ain't going there. But you know, I mean,
That's your friend.
we still need to find a way where we can, because I know of people who, if they were able to have been diagnosed and their family would actually recognize that, you know, cousin whoever has a mental illness and needs the assistance, then some of them wouldn't get to the point where they are in prison, because a lot of these people have the violent, schizophrenia affects people mainly as they start to hit, you know, in their early 20s. And then you have some who are violently schizophrenic, you know. So if you're able to track them from before they hit the prison system, and be able to give them drugs, because a lot of them have to go away to the
And
States.
those are usually the ones who get intervention. The people who have psychotic disorders such as schizophrenia, or who have a bipolar disorder, who have something that is very, very visible, they get attention.
But only if the family recognizes that. Like I said, some of them, you have a lot of them that will pray it away.
I'm not even sure that it's that they don't recognize it. I'm sure they do recognize it.
At that level, when it's a severe mental illness like that, typically people recognize it as being a severe mental illness in terms of looking at the definition and the continuum of mental illnesses.
And in the case that they do recognize it, what can be done? Because if the individual themselves, I've known personal cases where the individual didn't want to recognize it and didn't want to accept it, and who told everybody else crazy. He ain't crazy.
The families can do it.
The families can do. This is what I'm asking.
And see, and that's one of the things I want to talk to about, because
and that goes back right to what she was
because the
saying.
families are they look at it like this.
Right.
Exactly.
You see, and I think it's associated with the stigma
So at that
of having
point,
someone who is mentally ill,
At
and what
that
that
point,
looks
what
like
can
on
be
our
done?
family, what that looks like on us in doing that. And so I want you to talk a little bit about that, about what role does the stigma of mental illness play in our community not addressing the issue of mental illness?
I think it plays a large role for a number of reasons. Let's start with the fact that, you know, people do tend to go into denial about the things that are painful or about the things that they don't want to see. And so we can be as intelligent as anything and not want to see something that's right in our face or that's in our family and right in our face and right in our children or our spouse, and still go into denial and still rationalize it and explain it away. And so I think part of that, maybe it's due to the stigma, or maybe it's just due to it's something that's very, very difficult to accept. I don't want to appear to have failed. How could I have contributed to this? What if it's something that I did as a parent that is causing this? Maybe they'll just get better if let me just keep on trying until then. Oh, it's not so bad. And so there are lots of processes that people go through that may result in them not responding to some early signs and some early symptoms. In terms of the stigma, there is a very real stigma associated with it. It's not something that people tend to broadcast and say, oh, I broke my leg, oh, I have depression, or I'm having thoughts of killing somebody. You know, when I was in college, one of my friends actually had obsessive thoughts about killing people, and he would say to me, I just thought about choking you, or imagine that. And so, but no one would want to share those thoughts, right? If you were having those types of thoughts, it's not something you'd want to say to Miss Hanley, I thought so. Miss Hanley, because you might feel like, oh my God, she's gonna think this about me. She's not gonna want to hang around with me.
Oh my Jesus!
That's what will probably happen.
Right. But he didn't choke me. But he also didn't choke me, and he
Right.
probably wouldn't have, because it appears as though he had obsessive compulsive disorder. And some people who have obsessive compulsive disorder have thoughts of hurting people, but it's not that they're going to do it.
Right.
But it's very frightening for them. It's very scary for them. and it's not something that you want to tell people.
And that's a symptom
so
of mental health or mental illness?
That is a symptom of mental illness, of obsessive compulsive disorder.
And
Or it
sometimes
can be.
the
Or it
issue,
can be,
and,
or it can be
and
symptoms of
sometimes for the audience, the issue of mental illness can come up not because it's hereditary or anybody else are mentally ill. You just mentioned breaking your leg. Breaking your leg, and let's say you were a football player, so you can't play football anymore, can lead to you developing a mental illness where no one in your family has ever been mentally ill, but that alone can lead to something. And so,
The current state of affairs, to me personally, I really feel that we're seeing a lot more mentally ill and mentally unstable people on the streets
in
because
very
of the
subtle
current.
ways.
Well,
Economic
some
condition.
Some of them just plumb
That's
gone
what it is,
off.
it's
you
the
know,
economy.
And yeah, the economy, the government, and everything, especially these past 4 years, you're just seeing it even worse because, you know, I mean, so...
8. Let's get it correct. 8.
8,
Quick
yes,
question.
you know, but I want to say
Quick
4.
question before we
It's
close out.
specifically.
Your current outlook right now on the mental state or the mental health of the Virgin Islands, and where are we going, and where do you think it's going to go, or where do you think it's going to lead? Do you think it's going to get better? Do you think it's going to get worse? Do you think your current outlook?
That's a very big question.
But what we're going to do
Yes.
is that you answer that question.
Okay.
We'll come back from the break.
Okay.
Since he took up all the last
Time.
part, ask you
Okay,
the question.
sure.
So we'll come back in a moment with her answer. Back in a
Okay.
moment.
We got another part.
And welcome back. We are here in Via Voices talking about mental illness as we are here celebrating Mental Health Awareness Month. And we have Dr. Dara Hamilton, who is the president of the Association of Virgin Islands Psychologists, on the show with us. Again, thanks for being here tonight. Before we went on break, Boyd and asked, remember the question?
I do.
Okay, so let's have your answer.
The outlook. He asked me about my outlook
Yes.
on where we are and where we're going to go. I may be the eternal optimist. I've been accused of being the eternal optimist, and in fact, being an optimist actually promotes good mental health. And so I'm going to go along that route. Where I feel encouraged, at least by this month and what we're doing in this month. I think it is very, very important to be able to talk and speak out on the issue and get people to get in and get some help and be able to recognize the symptoms. I think that anytime an issue is on the table, then there is some hope and there is some chance. I mean, there's no reason to think that things would go any other way. So I would say I'm optimistic about it. I feel happy about what we've done so far this month, that there is a collaboration and there is some discourse regarding, and that you all and other people are so welcoming and willing to have us on shows to get the word out regarding mental health. And the more we talk about it, I think the less the stigma will be an issue that affects people.
And that's
getting
important
in.
because, as you know, the First Lady's sister, Lisa Galabert, suffered by mental illness, and I knew Lisa very well. And I just thought that she was just an awesome, wonderful person. But what I thought was really awesome and wonderful about her was that she wasn't ashamed to talk about her mental illness and the fact that she suffered from a mental illness. And to look at her, you wouldn't think that she has a mental illness because she doesn't look like what we think mentally ill people should look like.
Right.
You know what I mean? Am I
No,
off the
you're
mark?
correct.
She doesn't look that way. And so she was never ashamed to talk about her mental illness and to share it with other people so we can see that mental illness comes in all forms. And so, I was extremely saddened when, she took her life. And, she was one of the bright spots in the issue of mental health in the Virgin Islands. And hopefully that'll carry on, despite the outcome of her life, that will carry on as we go forward.
But one thing that our conversation has addressed, spoke about is actual the mental illness and identifying it and it being the how do we as a community now promote good mental health? Because I think Yoki started to touch on it where economic conditions can also lead to bad bad economy, bad economic conditions can also encourage poor mental health.
Exactly.
Where you may see depression, abuse, and other situations arise in our community. So how do we as a community work on promoting good mental health? So all of us, those that we can cut down on those that are not mentally ill but just have poor mental health.
saying despite the reality.
Yeah, despite the reality. That's a good way to put it.
Exactly. And sometimes it's like that despite the reality, you have to figure out how can you put yourself in a position where you're able to function, where you feel good, because you can't control some aspects of the reality, but you can control your own experience of it, or how you choose to react to it. Like I said, being an optimist, being an eternal optimist is
always smiling.
It's one of the standpoints. Maybe not always smiling, but being able to tell yourself comments or making self-reassuring statements and doing the activities that help to promote your own health. I think that it's an individual. It starts at the very individual level.
Okay, so
I think it is a community responsibility, but it's also an individual level where if I take care of my mental health, then I can help you take care of yours.
And what are some of the things that you can do to take care of your mental health? Because remember, mental health, as I think that you were basically trying to say, is, you know, what can we do to keep our minds straight, our lives in this happy medium, that we don't get in or fall into the kind of
one of the
depressive
things we
moods?
can do is empower the spirit. But according to doctors, the spirit is a philosophical thing. In other words, it's not necessarily a real thing. So
you
maybe
want?
I don't think I said that it wasn't a real thing. I think I said that when you're talking about spirit, that you're talking more about the philosophy with which someone guides and lives their life, and that can affect how healthy you feel and how well you feel. So I absolutely absolutely.
And in your defense, you didn't say spirit. Because spirit is no, you said spirituality.
Right.
Yes,
right.
so that's
I
what
feel like it's a
about. Yes,
spiritual process.
spirituality.
I feel like it is a spiritual process, and that there's some overlap between the science of making diagnoses and having a scientific diagnosis and an understanding that there are some genetic components and those issues. And how are we going to get at this? And how are we going to help you understand your life in a way that you are able to regain your mental health despite genetic predispositions or despite those circumstances?
Let me ask this question, because for the most part, you know, I'm getting the impression that unless you have a little bit of money and you have like a really nice insurance, then somebody will be able to come and go to the couch to sit down and speak to somebody. But for the most part, you know, people don't have it.
Right.
You know, and I can tell you, I don't even know who or where to go if you needed to, you know, get that kind of service.
Right.
So you're addressing the people who, I mean, the vast majority of Virgin Islanders who are just above the poverty level, at the poverty level, and below the poverty level, you know, who are suffering with some sort of mental illness. Where can they go to get some kind of help? You know, I mean, without feeling even more stressed.
Right. Okay, I want to address that question, but I also want to finish with his question in terms of what to do to be mentally healthy. There are some activities and things that we do to support our general physical health that can support our mental health. Eating right supports your mental health as well as your physical health. Exercise supports your mental health as well as your physical health. Meditation supports your mental health and your physical health. Us being a whole being, we can't separate those two things. And so even if you came in for therapy, to sit on a couch, we may do relaxation exercises with you. We may do breathing exercises with you.
What's
we may
a relaxation exercise?
For example, we may do what they call progressive muscle relaxation, where you sequentially tense and release your muscles to release some of the tension that can be built up when you're feeling depressed or feeling anxious, and that actually feeds back to your brain, so you're feeling less tension cognitively as well. And so those are things that people can do at home that can support their mental health outside of having to come in. In addition, making that decision. I'm very big on us being responsible for our own lives and our own health. And so if I notice in myself, I'm in a bad mood, let me see what I can do to get out of that mood. Let me notice, oh my gosh, this mood has persisted for 3 or 4 days. What can I do? I need to take some active steps. And I think that is the individual responsibility. However, I can also say to my friend, listen, you have been crying for 3 days. Let's talk. So if I'm in a good, healthy spot, then I can do that for somebody else. I think your question is of resources. You're absolutely correct. There are limited resources. People who do not have insurance very often can go to the health clinic, our mental health clinic. There is a mental health clinic, a public mental health clinic, where they can go to offer in Charles Harwood. I think that you can also access it through the Frederickstad Health Clinic. I believe that's located in Complex.
Oh, they're at Complex?
I think they
So
have
they're not
one in
Complex,
Complex as well, and they
Oh.
have counseling that you can go to there as well. And so there are public services that people can access if they don't have
Doctor,
they don't have insurance.
I have a question, and this is something. Don't laugh when I bring it up. I have a girlfriend, and she used to say, Clint, 'cause she said, whenever you're down, you want to have sex. She used to say that I'm using sex as a medication, and she used to tell me I need to get checked. I thought that was a good way of managing my.
That's a relaxation.
That's how I manage my thing. When I have a bad day, I want some. And that relaxes me, put me in a good mood, and I can face the rest of my day.
You increase the serotonin.
Is that a bad thing?
No, of course not.
I don't think it's a bad thing, but I think it just depends.
But is it a
on-
bad thing if he's in a bad mood?
But I'm not aggressive. I just want some.
Every day. Because I think what your girl is probably saying is, if it's connected to you being in a bad mood, or you're in a bad mood 8 times a day, every day, something needs to be
Maybe,
talked about.
maybe.
I'm just saying.
At that point.
I could be wrong.
Right, so those are the qualifiers. Remember, everything in moderation and reasonable. And so if things have gone out of reasonable proportions, and that's one way to look at mental illness, is if it has gone out of reasonable proportions, if it is causing some type of disruption in your life, then it is problematic. It is a problem. Okay.
But it may be problematic for Missy because she can't handle it all the time like that.
You need 2 girlfriends. But anyway.
Oh Jesus.
I like your assessment of the situation.
A question, and it's kind of twofold. I don't know how to put. Okay, in the news locally, they're talking about this child. I had the sign around.
Shaming, the public shaming.
Public humiliation of a child that's 5 years old. Where they put, I'm a thief and I'm a liar. I know that could be very traumatic, and I want to bring that into. This thing with the senator. The senator and the school, the corporal punishment.
Oh, right.
Is that a perfect?
I think that's a good example
Is
of
that
shaming.
Is that a good example of what they were talking about as far as the punishment, or?
But that's not really corporal punishment.
I'm trying to tell you.
I understand what you're saying, but
it's not. I'm not
But
saying
can they
it's-
be akin to each other?
Right, exactly. It's like it's,
Humiliation can be traumatic. It can be traumatic. I think we look at trauma to be, just physical violence or witnessing violence or something having to do with violence,
and that's why
which it can be, but it can also take other forms, and humiliation can be one. Trauma always goes from the standpoint of the recipient. How did I experience it? Because it may be traumatizing to me, but not to you. And so trauma really goes from that standpoint of how did I experience, how did the so-called victim of the trauma experience it. And if they didn't experience it as traumatizing, then they haven't experienced trauma, as it were. There are, of course, some textbook definitions of trauma. If you cause bruises and injuries and so forth, whether it's intended or not, it's child abuse. Done. It's child abuse. Whether that child experienced it as traumatic, it's child abuse.
So, to expand on his point then. So, because part of this whole thing with getting corporal punishment banned was saying that every child who receives a spanking later on now develops some sort of a mental issue. And I don't know about everybody else here at the table. What I know, I grew up in my time where, yes, you get your tail whipped when you did something wrong. And I think all of us are regular upstanding members of the community. So how do you now make the correlation to say that, yes, if you spank your child is going to grow up to be the next Jeffrey Dahmer, when you have several sets of generations who have gone through, And
I don't see that as the conclusion that's drawn. The conclusion that's typically drawn, corporal punishment is, they have found relationships between severity and frequency and so forth of corporal punishment and poor outcomes in children. Okay, but I don't see that as being the only conclusion that's drawn. A lot of times we look for those very obvious markers to say, look, I turned out okay. But then if we look a little bit deeper and we look at our relationships and we look at our ability to attach to other people, we look at our ability to have a trusting relationship, and we look at the quality of our relationships, we may find that they're impaired. And so it comes from, a lot of different, it may be a lot of different circumstances that led to that, but that could be part of it. And the association with corporal punishment. And so we feel like we're okay because we're going to work every day, and I wanted to hit on that because we've been talking about mental illness primarily as something that is obvious and florid, and you see them on the street, or they need to be in the hospital, but mental illness also manifests in other ways that maybe we're not seeing. Like, for example, highly intelligent women are very good at masking depression. So you can have very intelligent women who you never know that they're depressed. They're going to work every day. They're fine. They're socializing with you, and they're miserable, and they're very, very unhappy. And so you don't always see it manifested on the street.
But it's not a symptom of society, because society tells you that you must be, especially as a career-driven woman, that you must be strong, you must be independent. You know, you must not go and see, especially this Western society, everything is be strong, show no sign of weakness. You know, but I wanted to go back and touch on, and you know, I bring another little devil's advocate here now. So you're saying that everybody who has had a taste of licks growing up, everybody is scarred.
Nope, I didn't remember saying everybody. However, I don't think that we understand completely the relationship, and that we tend to look at it as, hey, I'm doing okay, but we're not really looking at the subtle things that may manifest in our lives, and we don't know where those come from. I say to people sometimes that in adulthood is when we resolve our childhood. I mean, I don't know that we can say that our childhood, my childhood was absolutely completely perfect. Everything was just so nice and so wonderful, and I've come out with free of issues, and I have no quarrel with my parents, and they just did everything fine and perfect, and so forth. And so I think that when you get into a therapy situation sometimes with someone and you start to delve, some of those things come out about the things that people wish that they did have and that they didn't have, either emotionally or in other ways from their parents. And some of the understanding of the relationship of the parents, we don't know where that came from, and you know, I'm just saying we can't always identify all the effects.
Something you're one thing I hate to hear and see, especially in society, we've become a society that's blameless. When I, as Yoki Hanley, go and do something, I'm going to look back to when I was 2 weeks old, and my mother probably didn't pick me up fast enough to say that's the reason why now I am how I am. Instead of saying, you know what, suck it up, be a woman, and say this is your fault.
And
I'm saying that
those aren't mutually exclusive. Those are not mutually exclusive.
No,
it could be because your parent didn't pick you up.
No. But I'm saying that especially when it comes to cases like when we have these ridiculous murder cases and so on, you know, or even with our children coming up when they're doing wrong, we're finding reasons to soften the blame. Yes, exactly. No, we are.
But it doesn't have to be both.
I agree with you.
It doesn't have to be both. It can be that you had this history, and that is.
I'm not saying for some it doesn't. I'm sorry, but I'm not saying for some it doesn't. But you have for a lot. Where they're using that as an excuse.
I don't know if it's an excuse or if it is a way to understand. Because no matter what happened to us, we are responsible for who we are right now. And that's where our power is. And that's why I say as an individual, that's where your mental health, you're responsible for your mental health is in terms of making decisions to do things that are mentally healthy and that will put you in a better state.
No, but I think what Yoki is saying, correct me if I'm wrong.
However, we can understand.
Right, but I think what Yoki is saying, I think I someone agree with her, is that while the person may want to take responsibility for their conduct, our society finds ways to remove or to mask the responsibility for that person. Like when we had that guy that went and fired shots in that school. Now he may have been mentally ill, I don't know. He may have just been evil and did what he did. But what you started seeing after surfacing is, he was a loner, he didn't have a father, his mother wasn't there. And it was like, then the conversation shifted to what all the parents didn't do for him, when it probably was just him.
Exactly.
I agree with you that I don't think it's mutually exclusive, but I think our society has a way of trying to remove the responsibility by placing it on what other people may or may not have done.
Interesting. That's interesting. That's a very interesting standpoint, because what that would mean is that they may not need the services because they are responsible. And so
but let's put it this way. You have someone who seemingly have wonderful parents who did all, what you think that they would do for them. They provided for them. They were nurturing for them. And then this child gets up and starts killing people. Right? But what our society would do is try to create some other avenue as to why this child is just not responsible for his own conduct as an adult.
That's interesting.
And so that's why I'm looking at it in the sense that, and it's maybe not everybody. Sometimes I'm not
No,
saying
it's not everybody.
I'm not saying that
happen in
some
one aspect, in one
Right.
segment
And
of
they're going
society.
to go through the
It
entire
happens.
history to say,
No,
well,
it
oh no,
happens a lot.
he didn't get paid
No,
for
no, what
5
I'm
minutes.
trying to say
quite
is
a
that
bit
what I'm
because
trying to
even
say
with
is it's
children
not
that
so
happens.
much it is not so much that there are children who haven't been scarred by things their parents have done.
Right.
Okay. There are those people.
Of course.
I get that. But then there are some, when you look at it, you know, what else could their parents have done to make your life the best that it had?
Right.
But you still do something.
Yes.
And what we end up doing as a society is we end up looking for something. Oh, the father didn't go to that baseball game that one day, and so that really upset him, and he held him, and that's what he held on for his whole entire life.
Yes.
And I mean,
Instead
in
of
my
accepting
opinion-
the responsibility for the wrong that you've done, we're finding a way to pass it off onto
And
something else.
I understand and I agree with what both of you are saying, but in my opinion, it's in certain segments of this society. Because in another segment, it's like you're predestined or you're preordained to be a criminal or to be
That's where you
violent.
come with nurture and nature.
So when do we let go and let God? Sometimes we don't hold on to too much things. Sometimes we need
Exactly.
to, we hold on.
I
If you
think
don't
let
believe
go
in
and
God,
let
then who are you supposed to let go to?
That's another thing.
No,
That's a whole
it's a fair
entirely different-
question.
that's a different show.
Yeah, that's a whole different.
But the first show for a whole other hour.
But I think when quickly we spoke about responsibility and a person taking or accepting responsibility with action. Suppose they don't know the responsibility. Suppose, I mean, how do you expose them to the responsibility or for them to accept responsibility? The education or whatever needs to
This
be
is
there.
a very, very complicated issue for a number of reasons, and I feel like yes, people are responsible, and there are circumstances that have created them as well, and that we need to identify those circumstances so that we can intervene. I say this everywhere I go, so I'm gonna say it here. Years ago, I was watching C-SPAN where Colin Powell said that there are states that are using their third graders' test scores to predict the size of prisons they will need 15 years from now. So that means we can identify it in third grade. We can identify it then. So I think that's part of why people tend to look back. They want to know, they want to explain, they want to understand why did this happen so that we can do something about it at
Or
that
we can
level.
identify how
Because
many
you don't
black
get
and
away.
brown
You
children are in third
Exactly.
grade that we want to send, whether they're mentally or not,
Exactly.
we want to
Yeah.
send
Yes.
to the prison.
Right, I agree, I
Right.
agree. But my point is we can identify at that time. And so we know that there are circumstances that happen when children or people are young that affect how they mature and how they grow, and then they become this person that they didn't want to be and that we don't want them to be. And that intervention is necessary. So it's both. Taking responsibility for your life, but also knowing that yes, this scarred me. Yes, it did. And I have responsibility to get over that and be productive and be happy and be content.
I
That's
think some
my
people have makeup
responsibility to
scars.
do.
Man,
But anyway,
You guys are
I know. Dr. Hamilton, I want to thank you for being on the show tonight. I mean, it was wonderful. I think the audience learned a lot. I think we learned a lot about that. We'll take a quick break. We learned about Clint. We'll take a quick break because when we come back, I want you to at least tell people what you all have planned for the rest of the month.
Okay.
And where we can find you or where we can find individuals or numbers for people to be able to go and get some help if they would need to. So we'll be back in a moment.
Okay.
And welcome back. We had a very spirited discussion with Dr. Hamilton on mental health issues and mental illness. I'm so glad that you're here. What I want you to talk about, this is Mental Health Awareness Month. And we want you to share with the audience what's going to be happening this month, where they can get help if they need to ask questions about mental illness or mental health issues. And so I'll give you this opportunity to do that.
Okay, I'm sorry, I'm going to have to look down a little bit. I'm consulting my calendar here, but the Department of Health has a number of workshops that are going on, and you can call 773-1311 to and ask for the Division of Mental Health in order to get some more information regarding the times and confirm the dates on this. We are on this week. This week they will be talking about your brain and how to manage stress and the effects of stress on the brain, approaches to mental wellness, Next week they will be looking at Alzheimer's and how Alzheimer's affects the brain and the importance
And that will
of
be the
early
week
detection.
of May.
That's next week, starting May 18th.
19th. Week of May 19th. Okay.
Correct. They will also have a family-to-family caregiver support training, and I'm not sure if that's open or closed to the public, or whether that's a specific group that needs to present for that. But that's something we talked about this week at New Horizons Democratic Women's Group on their show, which is how important it is for families to get support who are dealing with people who have mental illness, and how that really can affect a family and someone who's a caregiver. They will have a laughter workshop, which is pretty fun experience. I actually went through the laughter workshop, and it's quite fun. And then the following week, the last week, they will look at schizophrenia.
The week of the 26th.
The week of the 26th, they will look at schizophrenia and how that presents in the Virgin Islands. They will look at managing stress and wellness. And then they're going to have a film regarding obsessive compulsive disorder. And so there are a lot of activities that mental health has arranged.
Oh, jeez.
And so, in terms of us, you're going to hear things on the radio. You're going to have some appearances. For example, next week on the 20th, is that Tuesday the 20th?
Yes.
Tuesday the 20th, Dr. Rita Dudley Grant and Cecile DeYoung will be on Straight Talk with Redfield to discuss Mental Health Awareness Month. And also on the 15th, we'll have Dr. Lori Thompson will be on 1340, I believe, AM out of St. Thomas. We are, confirming other appearances.
Okay.
And in the evening, on Tuesdays and Thursdays, you should have a Mental Health Minute on News Channel 2. So we've really been working quite a bit to get information out there. Hopefully, if I can get a little bit of time, I'll write an editorial for the paper on the subject of getting into therapy, what to expect if you want to come to therapy, which we want to, of course, say is a good thing, even if you're not suffering from a severe mental illness. It can improve the quality of life, and I think that's part of what we're talking about. It's just how to improve the quality of life for those of us who are functioning day to day with stress, and who feel like we need a little boost or someone to talk to, or we see ourselves sliding down a slope and we want to pull ourselves back up.
Awesome. Okay. Well, I know we've had a couple of laughs tonight on certain issues, but this issue of mental illness is a very serious issue.
Right.
And it is definitely something that we have to be mindful of in our community, and especially the Black community, where we have a stigma of not wanting to deal with the issues of mental health within our families, within our friendships, with our general relationships. But it is definitely an issue that requires our attention, and we have to do what we can to ensure that this issue stays to the forefront. This issue stays where we're able to attack it head on, so that we don't have that stigma anymore of mental illness, and that we can deal with the issues as we're supposed to deal with them. And so I want to thank Dr. Hamilton for coming on tonight and sharing with all of us. And hopefully you've learned something tonight about mental illness and something about keeping your mental health in order in a positive way, that you won't have to suffer through that. And hopefully that you'll also understand that there is nothing embarrassing or wrong about having a mental illness, and that you would seek help when you need to. And if you're a family member, that you will help your family member who's suffering from mental illness seek the assistance that they need. And so we at Via Voices applaud your organization and the Department of Health for pushing forward this during Mental Health Awareness Month. And hopefully we will all go out to these events and learn a lot more than we could have given you in this hour. So again, thank you for being on tonight. And we want to remind you that we have our Rock Your Voice campaign, and we'll be returning next week with our Rock Your Voice campaign with more of our political aspirants. And we want to make sure that your voices are heard, because they make a difference. Thank you and good night.